Is Lyme disease bacterial or viral? Lyme disease is caused by bacteria belonging to the genus Borrelia. Borrelia burgdorferi is the main cause of Lyme disease in North America, whereas Borrelia avzeli and Borrelia garinii cause most European cases. Despite the specific strand, it is still a bacterial infection. Here is a picture of Borrelia burgdorferi.
Mode of transmission. Transmitted to humans by the bite of infected ticks belonging to a few species of the genus Lexidus, hard ticks. Lyme disease is thus classified as a zoonosis, as it is transmitted to humans from a natural reservoir among rodents by ticks that feed on both sets of hosts, including deer and white-footed moose. Lyme disease bacteria are not transmitted from person to person. Watch closely as the tick bites into human flesh.
Mortality and morbidity rates. Lyme disease is rarely fatal, yet there is always a slight chance of death. The chart below indicates the number of deaths caused by Lyme disease from 2002 to 2007.
Origin. Lyme disease was first recognized in 1975 when children were diagnosed with juvenile rheumatoid arthritis in Lyme, Connecticut. Symptoms occurred in woody summer months. Tiny deer ticks infected with a spiral-shaped bacterium or spirochete, Borrelia burgdorferi, were responsible for the outbreak of arthritis. Affected regions. Lyme disease has been reported in nearly all states in this country, although most cases are concentrated in the coastal Northeast, mid-Atlantic states, Wisconsin, Minnesota, and Northern California. Lyme disease is also found in large areas of Asia and Europe. Recent reports suggest that it is present in South America too.
Signs and symptoms. A rash may occur. A small red bump may appear at the site of the tick bite. After a few days, the redness forms a bullseye pattern. There's a red outer ring surrounding a clear area. This may develop at more body parts. This is referred to as erythema migrans. Flu-like symptoms may occur, which include fever, chills, fatigue, body aches, and headaches. Here is a picture of the bullseye pattern rash, which if you see, there's one big circle, and surrounding that is another circle. After several weeks to several months, joint pain may occur. This typically occurs in the knees, but it can be spread to other joints. Neurological problems, such as meningitis, Bell's palsy, which is numbness or weakness in the limbs, may occur.
Diagnosis. The doctor will examine affected area and examine for a bullseye rash. An antibody test will be taken. A LISA primary test to screen for disease. Western blot files for confirmation as shown here. Prognosis. Lyme disease is curative, but the severity and treatment may be complicated. Some patients with Lyme disease report fatigue, joint muscle pain after years after infection.
Treatment and care. Antibiotics such as doxycycline or amoxicillin is taken early for 2 to 4 weeks. This prevents subsequent symptoms such as arthritis or neurological problems. Prolonged antibiotics may have serious side effects. Over-the-counter cream may be used to prevent joint pain. Acupuncture can relieve joint pain and inflammation. Prevention. Wear long pants, long socks, long sleeves when walking or hiking in areas high grass and woody areas. Insect repellent with DEET will prevent ticks. Check yourself frequently. Remove a tick with tweezers.
Here is a tick being removed by tweezers, the correct way to remove a tick. So the next time you're in the woods, not mine obviously,